Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. Today we have, for our first webinar, a very famous doctor from Athens, Greece, Dr. Cleopatra Nacopoulos, hosted by Dr. Joseph Mina Atala. Welcome, guys. Thank you for joining us for the first session today.
Thank you, Sean.
Dr. Cleopatra, just to get a little bit of an idea, is a very well-known professional with countless degrees. She is joined us in 2018 for our global summit and was so well received by our faculty and our speakers and our audience that we invited her back to join us this year for this year's global summit. And let me give you a little background, and Dr. Atala will get into this a little bit more. Dr. Cleopatra, just her degrees alone, BS, DDS, 3 MSs, PhD that she earned while practicing at the same time, which is phenomenal. And she has trademarked her own procedure that is commonly used now in the facial aesthetic arena across the world, the Cleopatra technique. It must be a miracle that her mother named her Cleopatra, and that was her destiny to work on facial aesthetics. We are so honored to have you, Dr. Cleopatra, and Dr. Atala will go into the details of your thorough background and CV. Thanks once again. Dr. Atala, you have the floor.
Welcome again, everyone. Good morning. And as you all know, we're very excited about today. I'm going to go very quick on Dr. Cleopatra's credentials, and there are a lot of them. So Dr. Cleopatra Nacopoulos' field of interest in GBR with the use of PRF and PRP, LPRF, IPRF, and APRF implants and laser. A native of Athens, she is president of WAUPS Greece and WAUPS Aesthetica and vice president of HELSOLA. Dr. Nacopoulos is a frequent participant in many conferences and hands-on courses for implants, growth factors, facial aesthetics, and laser. She earned her PhD, completed postdoctoral research, and in a scientific collaborate at the Laboratory for Research of the Neuromuscular System School of Medicine, University of Athens. She received her diplomate certificate degree of the ICI and earned an aesthetic medicine MSc from Queen Mary University, London. Dr. Cleopatra Nacopoulos was born in Athens, Greece. Bachelor of Science in Biology, Ghana University, 1985. Graduated from Dental School of Athens University, 1991. Master degree in Oral Biology, 1998. Master degree in Periodontology, 1998. Associate faculty member of Athens University till 1998. Certificate Master degree of SOLA Academy in Vienna University, 2005. Trained on facial aesthetic with the use of fillers and growth factors in Beverly Hills, California, 2007. Diplomate certificate degree of ICI, 2013. PhD laboratory for research of the Musculoskeletal System School of Medicine, University of Athens, Greece, 2015. Postdoctoral research laboratory for research of the Musculoskeletal System School of Medicine, University of Athens, Greece, 2015. Aesthetic Medicine MSc, Queen Mary University, London, 2015. And scientific collaborator for the research of the Musculoskeletal System School of Medicine, University of Athens. She's also a visiting professor of Nicolaou Testimotanis State University of Medicine and Pharmacy of the Republic of Moldova. Published many scientific papers in GBR with the use of PRP, PRF, LPRF, IPRF, and APRF implants, laser, and aesthetic medicine. She's a co-author of Platelet-Rich Fibrin and Regenerative Dentistry, Biological Background and Clinical Indications, Wiley, 2017, and lecturer in many conferences and trainer in many hands-on courses for implants, growth factor, and facial aesthetics and laser. And I have to mention she's also the first one to use PRF in the aesthetics, and we can see it in the book for Dr. Shakrun and Dr. Myron. Dr. Cleopatra, what an honor. We're happy to have you.
I feel bad now.
This is long.
Everything is a lie. Don't believe anything.
No.
Thank you very much. Thank you for the honor. For me, it's a great honor to be with all of you. with my friend Kianor, who is working very hard with GIS, with you, with the team, and with all the fighting dentists and doctors all over the world. Now we have the coronavirus, we should stay strong, and we have to do something to stand out of the crowd. So I don't want to keep you waiting. I will share my presentation. And today I am going to talk about PRF facial aesthetics and what else? My technique, Cleopatra technique. My motto, I love the people. All my life I am trying to do something to improve my skills in order to be able to give the best treatment for my patients. So my motto is stay young. With what else? With your own blood. And I am very, very honored that I have studied all these years with great professors throughout the world, starting from United States. I was so blessed as a student and as a person to have great mentors in my life. I have met people that they have pushed me to my edges. I have met people that they influence me to do different things and make the difference. And of course, for all that, I always had the desire to study and to learn more and to improve myself. I have got engaged with a lot of scientific societies. I tried to transmit all the knowledge I have gained all these years and, of course, my experience. I have trained thousands of dentists, doctors, nurses, not only for facial aesthetics, because you have the impression that I am only an aesthetic doctor. No, I am a biologist, I am a dentist, I am a periodontologist, implantologist, and I do lots of lasers, lots of bone augmentation and implants. And because I believe that if you do only the mouth, you don't really do something for the full aesthetics of the face. I have worked very hard for facial aesthetics, and of course, by using PRF, this has changed the game. This is very powerful. It's something that is working totally biological, and this is something that if you know how to use it really well, and if you can learn the tips and tricks of PRF, you can do outstanding treatments. And last and not least, I have a family and I have 2 clinics. I want to give a message to all the young dentists and doctors all over the world. You have to sacrifice something in your life. Of course, your family is number 1 because this is what you are. From the other hand side, you have people in your clinic that they believe in you. They have trusted you to do something for their health, to improve their faces. Now, the new game worldwide has to do with the aesthetic procedures. And of course, we know as dentists, for us, the most important area when we're talking about reconstruction of the mouth is what else? The aesthetic zone. So, if as dentists have invested so much for this part of the face, why not to enlarge the treatment to the whole face? So aesthetic medicine is doing with all these aesthetic procedures. And of course, we can divide it into parts. First, we have the surgical, and then we have the non-surgical. As dentists or as doctors, without having a specialization in surgery, such as plastic surgeons, we cannot talk about surgical procedure. So let's stay with the non-surgical procedure. This is something very important because we have lots of advantages. I'll give you an example. When we do surgical treatment, that means that we have a lot of time, a lot of money, maybe complications, maybe maybe infections, maybe pain. But when we're talking about non-surgical procedure, we're talking about something which is a minimum invasive treatment. And of course, the downtime is very short because, for example, you do Cleopatra technique, Prf aesthetics. After half an hour, you can go back to work. But if you do a surgical rhinoplasty, you need to stay at least 1 or 2 weeks outside of your work, and then you have to take more in consideration some other things, be careful. And the most important is when you go with the surgical approach, what is happening, if you're not satisfied with the results, you have to stay with the results or you have to do another surgery. But with these non-surgical procedures, if you don't like the results, then after a certain period of time, you're gonna go back to the situation that what your face was before. As a treatment, is faster, is easier. Of course, it's cheaper because most of the times you don't have to go to the hospital to do this kind of treatments. It has less risk compared to surgery. Of course, in this case, that you do non-surgical procedures, you have to be very careful who is gonna treat your face or your body, because a lot of people say they know, but they don't, and they're dangerous. As a procedure, the non-surgical treatments have less pains, and of course, the most important, we can keep the authenticity of the face. And this has to do with the way we proceed. I'll give you an example. If, for example, we have to do a treatment with fillers, if you listen to the demands of the patients that most of the times are crazy, then you can make the face looking very bulgy with big lips, big cheeks, and all these things. But if you know the physiology, if you know the anatomy, and if you respect yourself, you can do facial treatments, but keeping the authenticity of the face. Now, we talk about the surgical and non-surgical procedure. In order to do the non-surgical procedures, we have treatments, injectables, and we can divide them in 2 categories. We have the non-autologous, that the most famous are the fillers and the botulinum toxin, and we have the autologous treatments, which are the fat and the blood derivatives. So, as an aesthetic treatments, we might have injectables, non-injectables. From the injectables, we have the autologous and the non-autologous. As we know in our profession, of course, autologous is a gold standard. Fat is an ideal filling material. Blood derivatives are awesome. If you can combine these, it's ideal. But in order to use fat and blood as a dentist, in most of the countries of the world, is impossible. So we can use the blood derivatives in order to rejuvenate the skin and to augment the skin. And of course, if the demands are more, if you have a more aged skin, we can add Prf with hyaluronic acid. I will explain everything to you. As you see in this slide, we have a younger woman that by using the blood, the results are very nice. But if you have an older person, the combination of blood and fat is much better. Why? Because the fat has all the benefits, the adipose, stem cells and everything is a space maker. And at the same time, by using the blood components, the leukocytes, the stem cells again, and what else, the growth factors, you can induce the results and make them stay longer in time. Now, a lot of interest is in regenerative medicine. Regenerative medicine is something that it's very important because as a treatment is totally biocompatible. You don't have any problems with the toxicity, with the safety, with the allergy, with the hardness of the tissue. Is your own tissue, in order to rejuvenate, to regenerate your own tissue. And as blood derivatives, actually we have 3 protocols that we are using: PRP, PRGF, and PRF, and stem cell therapies. And of course, if you can combine stem cell therapies with PRF, is again very beneficial. Now, let's talk about the treatment with the blood. What do we use? We use the components of the blood. What do? We take the blood and we put it in a machine. We centrifuge the blood and we concentrate the platelets that gives us the growth factors and the leukocytes and some stem cells. So by using this, we can use it in order to rejuvenate the surface of the skin or go inside the skin and augment the skin. Now, the first protocol was PRP, platelet-rich plasma. And why? Because we had the anticoagulant factor and we could use this as a liquid form in order to perform all these treatments. So PRP is the first generation that it was used in order to do facial aesthetics. It was invented back in 1998 by Professor Marks of the University of Miami. Then the second protocol is the plasma rich in growth factors by Anitua, 1999. And then came PRF, platelet-rich fibrin by Joseph Sucrun. So you see that blood derivatives started to be used in dentistry and aesthetics long time ago. It's nothing that it's so new. A new use of PRF is not in dentistry, but in facial aesthetics. We have done a lot of work with Professor Sucrun. We have done a lot of cases. We have tried different things in order to improve our treatment. So it was launched, PRF in facial aesthetics in 2014, but almost 4 years before we were working on this project. So now let's go back to PRP. Why PRP? PRP is very well known. Everybody is talking about PRP, vampire facelift, Dracula lifting, whatever. But if you go back to check the research, you can see that there is no consensus about PRP. And the problem is that there is no consensus about the count of the cells, the speed that we centrifuge the blood, and of course the time. So there's a lot of confusion. And this is happening because everybody is taking one centrifuging machine without taking in consideration the inclination of the tubes, the radius, the G-force, name it. And they name the protocol PRP. So there is no standardization. Now, as a procedure, of course, it was the first generation. The other bad thing, not bad thing, but the other thing that is happening is it's using anticoagulants. And if you remember 2-3 slides before, I was talking about the regenerative medicine. That means if you have a way to do this kind of treatment without using any additives to the blood, I think is very good. So PRF is not using any anticoagulants. PRP does use anticoagulants. And of course, we centrifuge the blood for PRP with a high G-force. And in many cases, in many protocols, we have to centrifuge the blood 2 times. So that means a lot of manipulation, anticoagulant factors, chemicals inside the blood, and it's a procedure that takes a lot of time and is very expensive for the doctor and, of course, for the patient too. Now, from the other hand side, we have PRF, platelet-rich fibrin. It's something that is very beneficial because with PRF, we have the liquid fibrin. The liquid fibrin is a bioscaffold that the growth factors are getting attached, and we have the slow release of growth factors during the healing process. That's why we have these amazing results by using PRF. And I'm not talking about aesthetics, I'm talking about dentistry. So this thing is not only working in a specific field, is working everywhere. And I will show to you how PRF is working on wound healing, is working on regeneration, or augmentation of the skin, hair regrowth. So it's a magic product, but you have to follow the protocol. You have to have the same machine. You have to have the same parameters in order to be able to standardize something. And of course, the magic about this right now is that we're very able to have these liquid fibrin matrices in order to be able to rejuvenate and regenerate the skin. Because as we get older, what is happening, we're losing volume. That means we're losing fat and collagen. So if we have a way by using our own blood to stimulate collagen production, this is very, very powerful. Now, the new PRF, the latest PRF, because as I told you, PRF has a history. PRF started only for dentistry, and by the years, with a lot of research, a lot of cases, we have been able to have the PRF liquid. So the PRF liquid was produced on the low speed centrifugation concept. With this concept, what do? We can reduce the G-force. That means we centrifuge the blood with lower rounds per minute, and with this way, we can save more cells, and we achieve the injectable IPRF, which is a liquid enriched in white cells. And that means with the new PRF, now we're able to either put it on the face and do microneedling or inject it inside the face. So this is very nice because it gives us the opportunity to rejuvenate our skin with our own blood. This is very, very important. Now, in order for you to understand why I say that IPRF is very powerful, the liquid form, you have to see and to go through the history of PRF. PRF in the beginning, back in 2001, it was centrifuged in a high G-force, which was 708. By the years, and with a lot of research, and this is the very magic thing about Joseph Choucroun, he is a hard teacher. He is a person that puts you to the sky and push you to the sky, but he's a person that he never stops. So from something that it was liquid, solid, by doing all this research, because this is happening between all these years with many, many research, he was able to reduce the G-force. And as you see, by reducing the G-force, what is happening here? We have more growth factors and we have more leukocytes. So the idea started step by step, and here, with reducing even more the G-force, we can have multiple growth factors and leukocytes. I'm sorry for that. So this is IPRF. And now we're talking about IPRF plus. The question is, what is IPRF and what is IPRF plus? IPRF was the previous protocol with the orange tubes. Now IPRF plus is with these tubes. They're 13 ml. And they have this purple color. They're totally empty, and we centrifuge them in 700 rounds per minute for 5 minutes. You see in this study by Wang saying that if we compare what the number of the fibroblasts from control to PRP and to Iprf, we see that we have more what cell migration, cell proliferation, collagen synthesis, and this is very important because we can stimulate the fibroblast in order to produce what we're losing when we get older. And of course, you see here that we can achieve with Iprf more collagen type 1. But if we're talking about a young person, we can use Iprf in order to do a microneedling. But when the demands are higher, when a person is older, we need something more powerful. So we need something in order to get more collagen. In order to get more collagen, we have to increase the fibrinogen. And this is the Prf liquid. We're using the same tubes, 13 ml, purple cap, and we change the parameters. This is something that we're using to fill the wrinkles. This is a biological filler that doesn't harm your system. It's totally autologous. It's totally safe. These are the parameters: 1,300 rounds per minute for 8 minutes. And of course, by using PRF, just to summarize, we have the opportunity to regenerate the tissue by creating new vascularization with the use of the inflammatory cells, the growth factors, the fibrin, and the stem cells. So we have something very powerful that comes from our system. The most important when we're talking about PRF and every individual of you is to understand that your blood is not totally the same like mine. I mean, the genes are different. So my treatment, it might be more successful on me because I have a better system. I don't smoke. I am not too heavy. I exercise. I eat well. And I live in a country with less pollution. So PRF is very powerful and depends on every individual. Now, about my idea to start using PRF in facial aesthetics. As you saw on my CV, I have started working with growth factors back in 2003, 2004, when I first started with lasers, and I got the ideas from Professor Martelli in Florence, Italy. And I was using this, and at the same time, I was using Botox and fillers. So the idea started, why not using something which is coming from your own blood in order to fill up the wrinkles? And in the beginning, I was using another protocol, and I was centrifuging the blood in a very high G-force, like rounds per minute, for a prolonged time. I started using this. I saw improvement, but when I was starting PRF, I changed and I made some manipulation to the old protocol, and with the cooperation of Joseph Choucroun, I started using PRF in these two different forms, and the idea was simple, again, saying what? If you traumatize a tissue and you cause an injury, what is going to happen? First of all, you're going to have the blood clotting. So something from your system will stop the bleeding. Then what is happening? We have the inflammatory response. Then after a few days, we have the proliferation of the cells. And then what we have the tissue healing. And for another 2 years, we have the tissue maturation. So the idea for me was that if I can traumatize the skin, for example, and I can add PRF liquid, because the old protocol for PRF, it was ideal, but only for the mouth, to use it as a solid. But from the time I had the opportunity to use PRF as a liquid, either in the form of IPRF or in the form of APRF liquid, then the game started. It was like a revolution in facial aesthetics. And you're not gonna believe it if you don't have the experience. So you have to try and you have to see yourself. So my idea was born from these powerful products, biological products that I had. From one hand side, I had IPRF Plus that had a lot of cells. You remember the slide with a lot of cells? From the other hand side, I had APRF, which had a lot of liquid fibrin. So if you combine these two things, you get the benefits of the biological matrix and the cells that they're getting together. And then I was doing a lot of cases, and I was trying, you know, to give a name, to give like a identity to this powerful PRF liquid. And a lot of people were saying, this is Cleopatra's protocols, this is Cleopatra, this is, and I said, why not to name it Cleopatra technique? And of course, there is a history behind that and a thought. First of all, it's my name, it's authentic. PRF is authentic. Then has a history like Cleopatra. PRF started back in 2000. Then it talks about cosmetic beauty. That's why I have the C. And then what else? It's totally natural. People right now worldwide, they want to use something that it's organic, that it's totally natural. They're going towards to another lifestyle. So Cleopatra is not only the combination of these different protocols, but it's a philosophy. It's a philosophy of going towards a natural way of life, to quit smoking, not to drink heavily alcohol, to exercise, to do things, to eat well. So this Cleopatra technique is working, and I am going, pretty soon I will publish an article showing how a genetic profile that has to do with the way we eat, we behave, will affect this kind of treatments. And it's magic, because this is not only the face. The face is the part of the body. So Cleopatra technique is something that it was named in order to be attractive to the patients, because everybody now wants to do Cleopatra technique because they don't want to do a Dracula face treatment. They don't want to do a vampire. They have in mind Elizabeth Taylor, Cleopatra, so they want to do these treatments, and of course, they see very good results. As I told you, I love to prove what I say, and this is the study that we use the telomeres as a biomarkers in order to prove that this PRF treatment is very satisfactory for our patients. And not only that, with the telomeres as a biomarkers, we are able to prove and to design some other future studies. And of course, I am very happy that me and Dr. Ana Maria Vesala, she's an oral surgeon. She happens to be my daughter, and she has helped me a lot of times with cases, with publications, with ideas. So we have published about Cleopatra technique and skin rejuvenation of the lower face, because as dentists in Greece, we're allowed to treat this area. So we have done these treatments, and believe me, it's something that patients love it. Now, as a procedure is very simple. First, we have to prepare the skin. We have to give instructions to the patients what to do before the treatment. And of course, this is a whole course of 1 day, how the skin has to be prepared, what products should we use, and I'm talking about totally autologous and totally natural products as creams and as soaps and all these things. But we'll talk about this when I'll meet you in person and we'll have a course. One thing that I want to mention is when we're talking about skin preparation, we have to make sure that all the time the skin has to be clean before any kind of procedure. Because as dentists, we know what it means cleaning off the mouth, how to disinfect the area. The same is with the skin. But we have to be very careful because we don't want to destroy the pH of the skin. Now, a lot of patients ask, is going to be any pain? Am I going to have any problem? Usually, the patients are having this kind of treatment with a topical anesthetic cream as EMLA 5%. Sometimes you have to sensitive patients, or if you want to work more aggressively and more deep, to do some local anesthesia, and in rare cases, maybe you do a block anesthesia. With PRF, you have nothing to worry as long as you keep two things. Inject very slow and move around. So if you do this, you don't have anything to worry about. Now about the pain. In the beginning, try to do more superficial treatments, get all the benefits, or not the benefits, get the skills and get the self-confidence, and then you can do more aggressive treatments. Now, as a procedure and as things that you need for the treatment, I believe that you don't need too many things. And of course, this is something that it's not so expensive for the patient and the dentist. The other kids with PRP, they have a lot of money, and of course, if you get something very, very high, then the cost it's very high for the patient. So I'm not going to get into financial things, but of course I know as experience, because I have used many protocols worldwide about blood derivatives. This is the cheapest and the safest and the easiest to use. So you need tubes, you need different sizes and kinds of needles, maybe you need a cannula. You can use these syringes here, or you better use the lure lock in order to lock it and don't have the problem of getting all the splash in your face. And we have to be very careful to disinfect this area, because with this needle we enter inside the vein. So we have to be very careful, because we don't want to contaminate the blood of the patient and have bad scenarios. So clean this area very well. We're using the butterfly. It's very easy to use. And of course, the learning curve of venipuncture is not so long. You have to follow a good course with people that they really know how to draw blood. So these are the tubes, and this is the plastic cap that you use, and it's working with negative pressure. So let's go back to what we can do. I'm sorry. When we're talking about skin rejuvenation, we said that PRF is working with trauma. That means we have to traumatize a tissue, and at the same time we add the PRF, because we have multiplied the components of the blood that they're useful in order to initiate the inflammatory response and have the tissue healing. So we can traumatize the skin with 3 different ways: the mechanical, the thermical, and the chemical. From the mechanical, we can use something that is causing a trauma to the skin, and at the same time, we can add or inject the PRF. Now, this is the Dermapen. Dermapen is ideal. It's something that you should start with It has a certain movement of some needles here, and these needles are puncturing and penetrating the skin from 0.25 up to 3 millimeters, and maybe in some Dermapens even deeper. And at the same time, you can apply superficially the PRF. If you want to put it inside the skin, you have to use this syringe with different sizes and lengths of needles. You can do this kind of treatment with the derma roller. Derma roller is a harder treatment to do. That means you have to have the skills in order to do it, and the downtime is longer here compared to here, because here you're talking about 12, 16, 20 needles. Here, in some cases, you're talking about 192 or 198 needles. So you understand the difference. But the idea is, in order for the PRF to work, we have always to traumatize the skin. The treatment is called microneedling, and what is happening, we go with this on the skin and we create microchannels through which the Prf liquid will be inserted inside the skin. And of course, this is the easiest way to start. Here, what we have done, we do the PRF treatment in combination with the microneedling. You see here, we have the petechia. The petechia means that we have caused a micro bleeding in the capillary dermis, and we apply the PRF, which is being absorbed inside the skin. The protocol is different, depends how deep we work inside the skin. We can do this treatment once every 15 days or once every month, depends how aggressive we are. And of course, the average is 3 to 4 sessions totally. And of course, we can repeat the procedure according to the needs of the patient in 3 months, 6 months, or once a year. Another technique that we use in order to rejuvenate the skin is the point-by-point or micropapullar technique. And with this technique, very easily, by using a syringe, we inject it inside the skin. It seems that it's very easy, which is very easy, but it has a lot of tips and tricks that you have to learn by people that they really know PRF. Because a lot of people, they learn PRF or they learn PRP or they learn some procedures, and all of a sudden they are becoming experts and they teach their own way. In order to be successful, please try, I don't care which protocol you're using, but try to learn by the best. This is a very beautiful young dentist. She is from Serbia. She came to my course and she's beautiful, but in this case, you have to do this kind of treatments in order to keep the beauty and delay the signs of aging. So in this case, I did the micropapullar technique. That means I put inside the skin on the dermis, I put some Prf liquid. So you see here the papules, and at the same time, I used the Dermapen and I applied the PRF on the neck. And as you see, from here to here, there is no big difference in the way that the patient can walk out of the clinic. That means with PRF, if you do this treatment, which is a little aggressive, that means I have injected inside the skin, I have done the microneedling, and in half an hour, she can walk out. So with PRF, the healing is very quick, and you're gonna see the last case that I will present, and this is how we can rejuvenate the skin with no complications and bad scenarios. Now, the third, which is very important, is the augmentation of the skin. When you're getting older, what you lose volume, you lose fat, and you lose collagen. The contouring of the face changes. Maybe you have some asymmetries because you sleep from one side or from the other. Or maybe you have some acne scars. So the demands are not the same to the different kinds of faces or of people. So Cleopatra technique is very powerful because by using Iprf Plus and Prf Liquid in combination, you can inject superficially, you can inject deeper, you can use a cannula, you can use this magic with any ways. The most important is to know how to use it, because some little tips and tricks will make a big difference. As a post-treatment, what do you do? Usually, I put a mask which is full of hyaluronic acid and vitamins, or I give them ice, or I give them the opportunity to do some light therapy. Now about the mask. I really like the mask. Why? Because I strongly believe that the mask, because it has, as I said, hyaluronic acid, some vitamins, some peptides sometimes, when you put it on the face, all these super ingredients are being absorbed by the microchannels that I have created with the microneedling. So with this way, I get the benefits of both, of PRF and hyaluronic acid and vitamins, and at the same time, I can reduce the edema and the redness, and the patient can walk out easily from my clinic looking great, but doesn't have any bleeding, any big edemas, or things that will make him or her be very, sad or unpleasant. Now, aftercare is a whole subject, and we have to take a lot of things in consideration. Our enemy, as we know, is the sun. So we have to be very careful about the exposure of the sun and how to treat the face after this treatment, how long we should hydrate the skin, what cream should we prescribe in order to maintain the results. So these are things that will really make the difference from one doctor to the other when he or she performs the same treatment. Just to give you an idea, this is a treatment that I did of the perioral area before and after. I did here 3 treatments, and you see the difference in the quality of the skin, the difference of the elimination of the wrinkles. The thing that concerns us as a dentist is the lips. And of course, if we can rejuvenate and regenerate the lips, this is very important. Why? Because we improve our work. So this is a treatment that was done 4 times every 15 days. And as you see, I haven't changed the shape of the lips. I just have been able to make more full lips and to improve the contouring of the lips, and of course to improve the philtrum. And this is the philtrum, I'm sorry, and this is the cubis bow. This PRF treatment is becoming more challenging in older people. That means we have to do longer treatment for a longer period of time. That means the treatment has to be combined with microneedling, with deeper injections in a different levels, with different techniques. You can use cannula, but from this unpleasant phase to this beautiful phase, keeping the authenticity, I think there is a big difference. This lady had done PRF treatment only 4 times. She started, let's say, January. Then she remembered to come back because she was very happy with 1 treatment after almost 10 months. So she came back in October, and she did 3 treatments total 4, and you see what we can achieve without anything else, just PRF. And I think from this skin to this, it's much, much better. But as I said, sometimes the demands are very high. People are not only satisfied to medium results, so they want something bigger. So in these cases, we can add hyaluronic acid with PRF. And why hyaluronic acid? Hyaluronic acid, we love it because it's something that if we have any complications, we can solve this with hyaluronic days. In my protocol, which is Cleopatra Technique Plus, I am using hyaluronic acid in a liquid form in different concentration of hyaluronic acid. This is a project and this is a research that I am working on. So I am combine IPRF and APRF, and I have the liquid hyaluronic acid, and I mix it up together, and I do injections inside the skin. So what I'm trying to do, I am augmenting the skin, and one of the most important features of this skin, of this treatment, PRF treatment, Cleopatra technique, is what? Is we can change the quality of the skin, because this is nothing new. With PRF, we can improve the vascularization. So we have a tissue which is old, and all of a sudden, by traumatizing this tissue and adding the PRF liquid, we can create vascularization. That means we can give to the cells all the nutrients they need, and we can give to the cells oxygen. This is my patient. This is a patient who trusts me to do her teeth. You see how the face is changing with the treatments year by year, and you see how this lady ended up. The thing is that as a combination treatment, and not only with the PRF and Cleopatra technique and hyaluronic acid, with the change of the philosophy, we can take a person who started like that, and after 2-3 years, we can change a person being like that. And the question is, do we want to have this change? For me, we have kept the authenticity of the face, but we have reversed the signs of aging, and we gave self-confidence to this beautiful lady. And of course, as dentists, we can fix the teeth, and we can take it many, many steps further. Now, a lot of people send me thousands of emails asking me, can I combine PRF with chemical pills? Can I combine it with lasers? How can I do it? PRF is magic. You can take it and combine it with everything. Everything that has to do with trauma. Chemical pills, what they do, they traumatize chemically the skin. So you can apply PRF and induce the healing of the traumatized skin. For me, laser. I love lasers. For me, lasers is my life. I love them because I started a long time ago. I have taught lots of thousands of dentists worldwide about lasers and now about aesthetics. You can use it in order to thermically traumatize the skin. And if the trauma is superficial, you can add PRF, or you can combine injecting PRF with the use of lasers. And of course, I'm very privileged to have people from all over the world that we cooperate with different kinds of lasers, and we try to do our best for our patients, because what I do, I don't do it for myself. I do it because I love people, and all my life I'm trying to see them smiling and to have them happy and beautiful. This is a case that I use my dental laser. This is a BioLaser laser that I use it in order to treat the area of the nose that had some pimples, and then I continue with the Prf treatment. This is how I do the neck and the décolleté, and I can use different techniques and methods in order to apply this kind of treatment. Another love that I have, because I believe in things that are working naturally for the skin and for the patient, is the low-level LED treatment. So I put the patient underneath this lamp. It has different colors, different wavelengths, and they penetrate inside the skin. And you take the cell, which is very aged, very tired, and you give energy to the cell, so you have the rejuvenation. So combine Prf, which is magic, with the light, which is another magic, you can have awesome results for the patient. Now I have a new toy that I use it for surgeries, and not only I use it to rejuvenate the skin, and of course it's something that is biocompatible with no side effects. So we see that step by step we're improving our work. Another question is, do we use the PDO threads or the cogs or any threads in combination with Cleopatra technique? Why not? You traumatize the skin, you put a needle inside and you leave a suture. By withdrawing the needle, you have a traumatized area. At this area, you can add Prf. Whatever you do with trauma and Prf is going to work. Now, about botulinum toxin. This is a case that she came to me and I did Botox. This lady had a lot of pigmentation and a lot of problems. She had gone to a dermatologist. They did a lot of chemical peels and she got this kind of skin. So when we did the Botox, we saw exactly what the problem was. So after 3 months, 4 months, we did the Cleopatra technique and we did the 4 sessions. And when she came back to take again photos, I saw this big difference. With the Prf treatment, I was able to reduce the pigmentation. There is a protocol. I have a way of doing this, but this is how the skin is looking now. And of course, about the combination treatments, when I first started, I was talking about the fat and the blood. These are the cases of Dr. Brazzini. Dr. Brazzini, he is in Nice. He's cooperating with Joseph Choucroul, and together they're working with a technique that combines the fat with Prf. This is ideal. If you have the way to take your patient in the hospital and they do the lipo transplant, let's say from the hip to the face, for example. If you mix it up with Prf, this is going to last longer and the skin is going to have an amazing, you see here, an amazing quality. Now, Prf is medicine, Prf is biology, and Prf can solve problems. And this is an example of a case that we worked together with Professor Ganati from the University of Frankfurt. This lady, as you see here, she has this big problem at the temporal area. Why? Because she had put hyaluronic acid. She got to a big infection. They had to excise this area surgically. She has fistulas here. So what we did some injections in this area, and you see how the skin is changing. So after 2 years, the skin has changed in depth. And this is important because we didn't have to put a skin patch here. We didn't have to get into big operations, and the patient is very happy because her skin is looking back to normal. So from here and the fistula to your temporal area, to have in 2 years with Prf this skin type, I think it's magic. Now, about wound healing. These cases were given to me from Joseph Shukroun. And what you do, you have an ulcer, you have a diabetic foot, you know what is happening, less vascularization, big wounds, lots of pain. Sometimes, because I'm working on some cases, big wounds that people cannot socialize, they cannot work, they cannot wear shoes. So this is very important. And by cleaning this with saline water, putting the PRF membranes, and now we have the trays and the new tubes, the SPRF, the green tubes, you can make large membranes, and by using PRF, you induce the healing. So this is very, very important. And now this is something that I love, and this is what I did. This lady came to my clinic to do her teeth. And now we had the lockdown. She was taking the tray out of the oven, and she got a burn on her breast. So she came to my clinic and she had great pain. This was like that in 15 days, and she couldn't wear any clothes. And I said, don't worry, we'll do something very natural. So I made with SPRF and PRF, the red tubes and the green tubes. I made these big membranes. This is the tray that comes with the box. And what I did, I put it on the breast, and I put this just to cover the area that it was very burned. It was like a 2nd-degree burn. And here I took a plastic from the paper that I used to sterilize my instruments, and I put a tape here just to isolate it, but I kept all the moisture. So 2 days after, she sent me this photo. You see how PRF was and how the skin was looking. And this is a week after. So from what we see that with PRF, we can have great results in a very short period of time. And this woman can wear her breast, her bra, and she can go to work, and she can feel no pain. Now, about the hair treatment. With PRF, with PRP, we have to know and we have to tell the people the truth. We can regenerate something we have. If you have lost your hair for many years, that means you don't have any hair bulb, and that means if I do the treatment with PRF, it's not going to be successful. But if I do this treatment with areas that they're still having hair bulbs, the results are amazing. We do one treatment every month, and you see that you can rejuvenate, regenerate the hair that are very thin and are going to die. This is another case that I did IPRF plus, and the results after 4 treatments. Now, another use of PRF can be arthritis treatment. This is how Joseph Shukroun is doing treatment of the knee. This is life-saving. Every time we have a course, I do different patients, and I get their feedback, and they're all very satisfied and happy with this treatment, which is improving their life, and they can be sociable again, because, you know, if you have big knee pain, it's very difficult for you to go out, to walk, to run, to do all your jobs. Now, I am using IPRF Plus for arthritis treatment. This is how I treat the joints, and the results are very promising. And of course, this lady, from a lot of pain, from an ankylosis to her fingers, she could move her fingers again. She had no pain, and the edema and the stiffness was reduced. By closing this webinar, I can tell you that I am in Greece. I love to see you in Greece and to host you here. Usually I do courses and I do a lot of training in my clinic with live patients, and we all work together. I teach you step by step how to do it, and now I'm working in lots of protocols, and I will be more than happy to guide you to this world of facial aesthetics. Now, we should keep in touch because this is something amazing. This is something that you should get involved. And of course, you can find me and send me messages to my profiles. I have actually 3 profiles, 2 Cleopatra Nacopoulos and 1 Cleopatra Chris Nacopoulos. I have 2 pages, Cleopatra Technique for Aesthetics and Cleopatra Technique for Aesthetics 2. And of course, 2 groups. One is Wax Aesthetica, and this wax was found by Professor Son, and we made division, branch of WAPS named WAPS Aesthetica. It was named by Kenneth Lee, a friend of mine from Australia. This is the father of this, the name of this group, and I established this group. And the other one is Aesthetica by Cleopatra Nacopoulos. Please be a member of these groups, post your cases, let's all grow together. If you want to see my courses or what I organize worldwide, or some other courses that they're being taught by excellent professionals from all over the world, is in GMDA Hub. And my Instagram is Cleopatra/Nacopoulos. So I try to post some information there, some cases, and we can all, by doing our best for our patients with PRF, which is magic, to be able to make everybody happy. If God wants, and if the situation allows us, I will have a course in Athens, Greece, July 23rd, 24th, 25th, and I am going to go about PRF step by step, from dentistry to facial aesthetics and to training. And I really will give you tips and tricks of how to proceed and how to do a very successful treatment. So by closing my presentation, thank you very much for your attention. Thank you, Kianor and GIS and all the board members and all the members all over the world for attending my webinar. And I also want to thank Professor Sukrul for the inspiration and the guidelines of this, and my professor Ali Gannon from the University of Queen Mary, London. And of course, I promise to all of you that I will do my best in order to improve myself, to improve my knowledge, and to even make this Cleopatra technique better. Thank you very much, and I hope to see you soon in Greece or
Dr.
somewhere in the
Cleopatra,
world.
it's beautiful.
Thank you.
Beautiful lecture. I'm looking at the questions here. Someone was asking, would you use it for the hair? But you already answered that. But I will ask, how often
Depends
do
on
you use
the situation.
for...
Usually, you have to treat this area. There are 2 ways. The first way is to rejuvenate, to regenerate something that you have, like hair that they're very thin and they're going to fall. So for this, you need to do 4 to 6 times every month. From the other hand side, some people are bald and they're going to have some hair transplant. So you can either do before the hair transplant, because you prepare the skin to adapt the transplants of the hair. And if you do the transplantation of the hair, then you can add PRF in order to induce the adaptation of the hair bulbs. So PRF can be used in either way. But in order to understand, you have to follow a protocol and you have to be taught about that.
For the facial aesthetics, how often do you usually feel that most of the people need it? Like every 3 months, 6 months? What is the most common?
We have to divide the people in two categories. The younger people, that they can have this treatment once or twice a year, and the older people, that they have to have a protocol of 4 treatments, and after this, you examine the face and you decide if the demands are higher or the needs are higher. You can do this treatment in 3 months. In 3 months, if somebody comes to the clinic and you evaluate the need, you can do another 2 or 3 treatments and then recall the patient. If you see in 3 months that the patient doesn't need this treatment, you recall the patient in 6 months. It's evaluation. And this is what I say. Okay, I will tell you everything, but I have to guide you through the case in order to understand and evaluate the case individually.
Someone else asked, would you use the PRF with ozone?
PRF with ozone. I have tried it, but mainly I don't. I use PRF with a lot of things. Now I'm working on some new protocols, so please, I cannot give you all the details because I want to make sure and to see.
Yeah.
But I have used on ozone to clean the face. I have used ozone before the treatment in order to prepare the face, but I don't really have something to tell very solid. So if you invite me in the next webinar,
we will, of course. And another question we have, someone is asking if you would recommend using it with minoxidil for hair regrowth.
With what?
Minoxidil?
Yes, of course, because this drug is inducing the use. This drug is for baldness, for alopecia, let's say. Okay, so this is something that will benefit the treatment. It's not going to go against the PRF treatment. So yes.
And with hyperpigmentation for the face, how is the effect of vitamin C? This is the same person.
Yeah, vitamin C is affecting the pigmentation of the skin. That's why they do treatments underneath the eye with vitamin C. Yeah, this is definitely. But with PRF, what you do, by the microneedling, we re-regulate the melanocytes. So if you have very pigmented area by using this treatment, but there is a protocol, you have to learn it. I mean, if I give you an information like that, it's not going to work. But what is happening, you revasculate the area, you reprogram the melanocytes, so you have reduced the pigmentation of the skin because the melanocytes are working properly.
You condition it. Some other person was asking, can you use it for sunburn and melanosis?
Sunburn?
Yes, this technique can be used in sunburn and melanosis.
Yes, this is what the same thing what he says.
Yeah.
Pigmentation of the skin and melanosis of the skin is similar. Okay, this is the most. I see some and you see some. Go ahead.
Dr. Cleopatra, would you ever consider injecting it in a dental, like the interdental papilla?
Of course I do.
For volume?
I started with PRF, using PRF for periodontology as a solid material. For example, you can do root scaling and planning, and you can use the fibrin in order to put it inside the pocket. But
so not just for surgery.
No, non-surgical, conservative periodontology. You do the scaling and you detach the gums and then put it inside. You can do this treatment, and instead of putting the small membranes, the gel-like, You can have the liquid PRF and inject it not only in the papilla, but inside the pocket. This is a protocol. I have this protocol. This is what I'm going to teach in my course in July. If we don't have the lockdown, if we have airplanes, if we have hotels, because PRF it started inside the mouth. I can rejuvenate and induce healing. For example, I have patients that they have diabetes, and I reopen to put the healing cups. And what I do, I take PRF, I make the membranes, I cover the healing abutments, and then I inject IPRF, and I induce the healing. So PRF is not only aesthetics. PRF is a biological product that if you know how to use it, you can use it for everything. You saw the burn on the breast. It was a 2nd degree. She was bleeding. She had pain. She was in antibiotics. And in 2 days, not because of me, because of the biology, I created vascularization. Can you imagine if you have a diabetic foot, big ulcers, people that they have cancer? Professor Ganati is treating patients that they have cancer, they have, overgone cancer, and they're using PRF to rejuvenate the skin because they're losing big parts of the skin, and they have necrotized skin. So this is something, it's a revolution, but you have to know the biology and you know how to use it. This is important.
We have a very interesting question here.
I'm back. Hi, guys.
One very interesting question. Someone is asking, would you use PRF in endodontic treatment? I'm guessing for epixification, for example, or something.
Listen, there are some people that they're doing this for endodontic treatment. I use PRF after apicectomy all the time. I do the surgical procedure and then I use PRF. But I am a periodontologist. I never done endo treatment and I don't have experience. I have read that they are using PRF when they do a pulphotomy. They're using PRF in order to regenerate.
Yes, I'm familiar with those studies, Cleopatra. I'm familiar with those studies. They're actually trying to regenerate the pulp using various kind of stem cells techniques, autologous, allograft. It's in the process of the making. Just imagine being able to take an endodontic retreat and inject the proper material underneath the tooth without having to remove the post and endodontic material and all of that, or being able to do a pulpectomy or a partial pulpotomy and being able to regenerate or maintain the pulp vital. This is very interesting stuff. It could be groundbreaking.
And I have heard and I have talked to people, but I just don't want to say any names, that they're working on projects that they remove the nerve of the tooth and they fill it up with PRF. And they leave it to be calcification of the roots, and they don't do the endodontic treatment. So there are a lot of things that are going on right now. Yeah. And in the beginning, I was the first one to start with the growth factors in Greece. And back in 2003, 2004, I was crazy talking about what I talk today. But today is a revolution, and some years ago, it was like madness. So this is something that we all have to work on. And what you do is amazing in your countries. And what you do is amazing because all together, coming with ideas, and we can go a step further. It's my opinion.
Dr. Cleopatra, what we have been noticing is that there are two fields in dentistry that are going to be hot in the next decade. One is regenerative dentistry, and the other is minimally invasive dentistry. Yep. So if you're part of those two items, there's so much exciting research going on. Some people growing teeth in vitro, in vivo, and in vitro and in vivo, actually. And other things that they're doing out of China and Europe, and it's fascinating. But there's not enough research yet, so it's all sort of in the process of being examined, and we invite all of our colleagues to also look into these opportunities and research for regenerative dentistry, stem cells, growth factors, and autologous blood concentrates. With that said, what an amazing lecture you brought to our colleagues and friends across the world. She's an absolute motivation and inspiration to all of our women colleagues, as well as male colleagues, of what is achievable. And we are very thankful for having you today, Dr. Nacopoulos.
Thank you so much. I believe, and thank you, Joseph. I believe that we are people from different countries. We are people that we love what we do, and we're people that we want to see the others smiling. So let's do hard work with ethics, and let's hope that we are going to meet soon again in LA, because Kianor, you have to treat me again.
Hey, Cleopatra, how about we go for 2 million in 2022? This okay. let's shoot for that. We're discussing that at the board level. 2022. Hope to have you back, Dr. Nacopoulos.
If I'm alive from Corona, I don't know.
You will.
Your blood concentrates will keep you young and healthy.
Doctor, it was a pleasure.
Okay, bye, guys. Thank you. Bye, everybody, for being
pleasure. Bye.
Bye.
Bye.